To give an example of the stages of intoxication related to BAC levels, expected BACs for a 150-pound healthy male on an empty stomach would be this. 0.05, a BAC, 2 to 3 drinks, become louder, more outgoing. A 0.10 BAC, 4 to 5 drinks, the judgment becomes effective, such as beer goggles. A 0.20 BAC would be 8 drinks, they appear to be drunk, the reaction time, coordination is affected. And a 0.30 BAC, 12 drinks, they can't walk, can't button coat, may fall asleep at the bar. In other words, they're done.
Here's the deal. Some people look at this chart and say, that's a social drinker. Other people look at that chart and say, there's no way I could possibly consume that much alcohol. And that's my point. The BAC chart is nothing more than a hypothetical guide. You know what you could do? If you could just post right in your entrance to your establishments a great big poster of the BAC chart. You got scales there. Your guests walk in, they step on the scales, you walk over, look how many drinks they can have, write that number on a post-it note, slap it on their head, send them on in. Because other things will factor into the absorbency rate of alcohol that the BAC chart does not consider, such as, were they drinking before they came in? How fast are they drinking? What are they drinking? How has that drink been mixed? Is it a warm or is it a cold beverage? Are they hungry? Are they dieting? What is their emotional state? Your emotions will change the chemistry of your body at any given point in time during the day. People are tired, depressed, they will come down with feel the effects of the alcohol faster than someone who's in a very good mood and maybe very angry. Tolerance, that's huge. There's some people out there who are professional alcoholics. I personally know some people who could literally take a breathalyzer, blow into a breathalyzer, you'd be looking at them going, how are you standing? I know some people, one drink, good night, Irene. Medication and alcohol. Obviously, pain pills and alcohol, not so much. But then you break it down to something as simple as over-the-counter cold medicine. You ever had a bad head cold? And you take that cold medicine and get through the day, and after work you have yourself a drink and you're thinking, wow, I just think like this more often. It's much cheaper. Drugs and alcohol. Cocaine and alcohol can increase the heart rate and affects coordination and attitude. Marijuana and alcohol slows reaction time considerably. Caffeine and alcohol creates a false sense of sobriety and insomnia. Amphetamines and alcohol creates forgetfulness, causing the person to take more of the drug, which can cause an overdose. Over-the-counter sleeping pills combined with alcohol can cause death. Club drugs mixed with small doses of alcohol can cause death and have been used as a date rape drug, such as GHB, ecstasy, ketamine, and Rohypnol. These four can cause an individual to lose control of muscles, drowsiness, and loss of memory. The above four mentioned drugs have all been used as a date rape drug, but alcohol is the #1 date rape drug because various studies have determined that over 50% of the men who commit rape are under the influence of alcohol, while over 50% of the women raped were under the influence of alcohol. Here are some additional reactions when alcohol and these drugs are mixed. Seldom used medicines, minor pain remedies such as aspirin, Excedrin, Anacin, Tylenol. Salicylates, aspirin, are gastric irritants with alcohol, can result in a gastric hemorrhage. Acetaminophen, Tylenol, can be toxic to the liver in large doses and can result in liver damage when combined with alcohol. Antihistamines, Benadryl, Dimetapp, Contact. It depresses the central nervous system. Side effects are sedation and gastrointestinal disorders. Additive sedative effect when combined with alcohol. Performance impairment and compromises ability to drive or operate heavy machinery. Some more seldom abused medicines. Minor tranquilizers, Valium, Librium, Dalmane. Gives you similar effects to mild alcohol intoxication. When combined with alcohol, it will create a heavy intoxication. Antidepressants. Alcohol may either counteract the drug's effect or enhance it, depending upon the particular drug. Results could be severe in some cases. Antibiotics. Penicillin, myosin drugs. Alcohol would generally interfere with the effectiveness of the drug's prescribed use. Opiates, morphine, heroin, codeine. These narcotics and alcohol are all sedatives and may increase each other's depressant effects. Mixing alcohol with other depressants dangerously increases the depressant effect on the body. The combination of morphine and alcohol may be lethal at high doses or in non-tolerant people. For example, a common dose of morphine to relieve pain taken with a high dose of alcohol could be fatal. Some impairment of motor performances is evident after low doses of alcohol plus opiates. Commonly abused prescription drugs, barbiturates. Drugs used to treat insomnia, seizures, and convulsions. It is also used to treat anxiety and tension before surgery. Alcohol and barbiturates, used together, increase the effect of each other. Stimulants, caffeine, nicotine, amphetamines, and cocaine. These drugs increase alertness and decrease fatigue.
They affect the central nervous system, speed up the breathing rate, heart rate, and activity of the brain, and increase blood pressure. Although they heighten one's activity level, they do not necessarily improve performance. Cocaine, which is the most abused, is a short-acting, powerful central nervous system stimulant that can be sniffed, snorted, inhaled, or injected. The drug can be both psychologically and physically addictive. Low doses produce short-lived euphoria and a feeling of increased energy, alertness, and self-esteem. Stimulants may mask the signs of intoxication, but in reality, the person is still intoxicated and has now become a wide-awake drunk. Then you have non-prescription illicit drugs, such as hallucinogens, LSD, PCP, mescaline. Hallucinogenic drugs affect the nervous central system and produce illusions, distortions, or elaborations of an existing reality. They may include a blending of sensations called synesthesia. The physical effects include nausea, anxiety, and paranoia, shivering, and facial numbness. Emotional reactions change rapidly from panic to elation. Hallucinogens affect people very differently, and the duration of the effects of these drugs varies widely. Alcohol and PCP are both depressants, so the toxicity of the PCP would be enhanced, resulting in impairment of coordination confusion, which would make driving very dangerous. LSD-type drugs are not depressants, but the addition of alcohol could increase the distortions of visual perception, making driving or operating of heavy machinery also very dangerous. Marijuana, cannabis, also known as weed. Marijuana or cannabis is a mild intoxicant whose effect is heightened by alcohol. It is not classified as a stimulant or as a depressant. Combined effects with alcohol on performance are additive. Motor skills, attention factors, and reaction times related to driving are also more impaired. The physiological effects of marijuana, such as increased heart rate and bloodshot eyes, are more pronounced. No evidence of unusual intoxication or toxic drug interaction has been noted. However, marijuana suppresses the brain's vomiting center, which can lead to greater risk of death from alcohol overdose because this safety mechanism is no longer active. Because you are responsible for conduct at your premises, you'll want to be active in stopping illegal drug use in and around the establishment you work at. Here are some drug activity prevention techniques. Actively monitor the licensed premises, including a periodic scheduled inspection of the restrooms to prevent the utilization of the restrooms for drug use or sales. Actively monitor secluded sections of the licensed premises to prevent illegal activity from occurring. Have adequate lighting both inside and outside. Regularly inform all employees of their affirmative duty to report all suspicious activity to management, including but not limited to a frequent pattern of telephone use on the premises by certain patrons, a frequent pattern of patrons trafficking to certain secluded areas of the premises, such as an isolated booth or a back room, a frequent pattern of particular patrons being approached by other patrons with evidence of money, envelopes, known drug paraphernalia, or other suspicious items, and the presence on the premises of drug residue or drug paraphernalia, such as vials, cellophane packets, cut straws, needles, roach clips, etc. Alcohol poisoning. Alcohol depresses nerves that control involuntary actions such as breathing and the gag reflex, which prevents choking. A fatal dose of alcohol will eventually stop these functions. It is common for someone who consumed excessive alcohol to vomit, since alcohol is an irritant to the stomach. There is also the danger of choking on vomit, which could cause death by asphyxiation in a person who is not conscious because of intoxication. Here are the signs and symptoms of alcohol poisoning. Mental confusion, stupor, coma, or the person cannot be roused. Vomiting, slow breathing, fewer than 8 breaths per minute. Irregular breathing, 10 seconds or more between breaths. Hypothermia, which would be low blood temperature. They'll have a bluish skin color or a paleness. If you suspect someone has alcohol poisoning, know the danger signals. Do not wait for all symptoms to be present. Do not leave a person who passes out to sleep it off. Be aware that a person who has passed out might die. If there is any suspicion of an alcohol overdose, call 911 for help. Do not try to guess the level of drunkenness. If they look like they need help, they need help. If alcohol poisoning goes untreated, well, the victim may choke on his or her own vomit. The breathing slows, becomes irregular, or stops. Heart beats irregularly or stops. The hypothermia may occur. Hypoglycemia, too little blood sugar, leads to seizures. Untreated severe dehydration from vomiting can cause seizures, permanent brain damage, or death. Note, binge drinking, the consumption of 5 or more drinks in a row by men or 4 or more drinks in a row by women within a 2-hour period is especially dangerous because the victim can ingest a fatal dose of alcohol before becoming unconscious. Also, you need to be aware of those with disabilities. It can be very embarrassing to both parties. Examples of this could be somebody who had a stroke victim, diabetics, injuries of some kinds, a surgery, cerebral palsy, multiple sclerosis. What you as a server want to do, you want to slow up how fast the alcohol can actually absorb into that person's bloodstream. There's 3 ways you can actively participate in this. One is with time. You simply pace your service. They don't get that drink unless you bring it to them, let them finish the drink, remove the old glass, then you can bring them out a fresh cocktail. 2 things happen there. One, you as a server, you're pacing how fast they can get the alcohol, and number 2, that's a form of better service. When you drop that check, at the end of that dining experience, that check and a couple glasses of water is all that needs to be left on that table. All the other flatware, plateware, stemware needs to be pulled. The second way to slow up the alcohol absorbency rate is with get your guests to drink something besides alcohol. An alternate beverage, juices, sodas, coffee. Water's your best ally for the pure simple fact they will drink it. Have you ever noticed when somebody begins to get intoxicated, they'll drink faster? Well, it's because they're dehydrated. They want a fluid. Give them water, they will drink that water. Remind them, you'll feel better tomorrow. It's a trick. And the third, and one of the most effective ways to slow up the alcohol absorbency rate is with food. Food is one of the best ways to slow up the absorption rate of the alcohol. When you get your guests to eat food, 3 really good things are going to happen. 1, it will increase your check average, which will increase your tip. Number 2, it's good for your working at, your selling product. And number 3, it will help slow the absorbency rate for your guest.